Hello and welcome to Amedisys Q&A session. My name is Kyra and I'm the director.
My name is Brian, accounts executive.
And today we're going to cover some frequently asked questions that patients and everyone has regarding home health. So Brian, what's the first question?
All right, the first question is the most common question asked at the Baton Rouge office. They wanted to know what is the difference between home health and home care. That is the most common question they get at the Baton Rouge office.
Well, that's a good question, and we have a lot of people calling asking that, not knowing the difference. The difference, home care, they provide sitter services, they do light housekeeping, and they can run and do errands for you, and those are paid by the hour. It's nothing medical, and most insurance does not cover it. You'll have to pay out of pocket. Home health, on the other hand, is more medical. We work with your doctor and we provide nursing services, physical therapy, occupational therapy, speech therapy, social worker, and home health aid. And with that, most insurances will cover and pay.
Well, what is the pay to the call? What is the cost to the patient?
Well, the cost to the patient of home health, for example, Medicare, it depends on your insurance. And Medicare, they know the importance of home health, so it's covered 100%. You don't have to worry about any bill or any cost to you. Other insurances, it just depends on the network, your deductible, and your co-pays. But what we do is we find out all that and relay that to you before we admit.
Okay, next question comes from Lake Charles office. Let's see. Make sure I'm editing it right. Who can get home health?
Who can get home health? Let's see, there's certain qualifications for you to be eligible for home health. One is homebound, and we get a lot of confusion on that, and we may cover that in another session, but people get homebound and deadbound confused. It's homebound, which means you can't be going to work. You can, however, leave your home, but it has to be infrequent, and it's a difficult task for you. You can go get groceries if you have no one to get for you, doctor's appointments, and different things. And also, you can drive and still be considered homebound. Now with COVID, if you're at high risk to get COVID, now you're considered homebound. Then another thing you have to have is a medical need. For example, a condition or a diagnosis, hypertension, heart failure, diabetes, something that we can come in and assist and teach on. Or if you have wounds or Foleys, that we can come in your home and help you care for.
All right, it's kind of a two-part question. The second part of it is, how does someone get on home health?
Okay. How do you get on home health? Well, of course, if you meet the conditions what I just previously described, then we have to have an order from your doctor. And that can be done by, you can either contact your doctor yourself, or you can call the home health of your choice.
All right, next question comes from actually way down south, Houma. I'm sorry, can you hear me, Cara? I had this.
Yes.
The question in Houma, how do they choose a home health? How is it chosen? Like, what's best for the best needs of the patient?
Gotcha. First of all, home health, the choice is the patient's choice. It's on you. You choose your home health. And I always tell everyone, do your research. You can go to cms.org. That's done by the state, and they rate home health according to stars, like patient outcomes, like how did the home health improve the patient with their mobility, their ambulation, their pain, and different types of factors. And the highest is 5 stars. Now, I'll let you know that we at Amedisys, in 2019, for the entire year, we were 5 stars. For 2020, we were 4.9 stars. And I just say check that out and make sure you're getting a quality home health. Another is check the staffing and what disciplines that home health have, depending on your needs. For example, here at Amedisys, we have all the disciplines covered. We have nursing, we have physical therapy, we have occupational therapy, speech therapy, behavioral nursing, social workers, home health aides, and we even have a dietitian on service.
Okay. Next question. Actually, our clinician, this is the most asked question at the Opelousas office.
Okay.
With the noticeable decrease in admits from the hospital and stuff, people wanting to come due to not come actually as a patient due to COVID. What precautions are being taken right now by our company to ensure the safety of patients that do come under our care?
Got you. Well, number one in medicine, our patients come first. Their safety. That's our goal, is to make sure our patients are safe and well cared for. Our staff are fully trained. They have been through numerous courses, and they had to take tests on those courses and pass them. We do daily screening, which includes temperature checks before they begin their workday. And they have all the proper equipment, including masks, face shields, goggles, gloves, gowns, and of course, most of that is disposable, and then the reusable things, when they're doing blood pressure checks and everything is cleaned before and after each use.
Kyra, I have some questions actually from the hospital and stuff. Did you want that on this segment, or do you want to?
I think we can do that on the next segment.
Okay. Well, speaking for medicines, if anybody has any questions at all, please call our office at 337-948-3223, or you are welcome to call my personal cell for the company, 337-305-0838. My name is Brian, Director of Operations.
And again, I'm Kyra, and we'll have more videos to come to keep you all informed, so stay tuned. Thanks for joining us.
You didn't catch my joke at the end? I said, Brian, I'm Director of Operations. I'm actually accounts executive. I was just messing with my partner here. Thank y'all so much for coming in and listening to what we had to say.
Bye.